Not all people who live on the streets are hooligans or are criminals.
They mustn't consider that everyone homeless is because of drug addiction. People are judgmental, They look at you, they think probably you're on drugs, you're a thief, they don't trust you.
The population of the homeless at Trinity is very diverse. I think some of the myths that we looked at was crime, drugs, things like that. Certainly the homeless population that we studied were not habitual drug users. And I think they weren't particularly prone to crime either.
Once I get a job, I can build up my life and be independent.
My family, I haven't seen them for 5 years. Wherever they are, I don't know how they feel.
Life is pain. I feel the pain, but I don't cry.
Life on the streets, is very tough, because sometimes you don't know where to eat.
I'm from Germany. I arrived last year, July, and coming here to Joburg wasn't easy all the time because there are homeless people around. They are ignored because people don't want to face them. And my question was how can I help?
I'm one of the volunteers at the soup kitchen here at Holy Trinity. The love that we are extending to the homeless people is real love, because most of the homeless people out there, some of them are there because of the circumstances that may have pushed them to the street.
So it really helps a lot to know where your next meal is.
Maybe sometimes about 200 people line up here. Then they start dishing up there.
I always eat in the dustbin every day, every night. So I decided to come to Trinity so that I can get food.
Some of us were a local immigrant from Eastern Cape, KZN. So
the church helped me to get an ID because I lost my ID.
But I needed a full-time job. I don't want to rely on a family.
And me, as a person who is academically gifted, that I find it disappoint myself and too many people.
You don't know what people who are living on the streets are facing every day, Because, you are being judged. People look at you, they don't care,
I feel safe here. I think that my work is valued. And I'm very grateful for being here, that I'm allowed to do this work, that I'm allowed to help.
It gets you to know what the struggles are on the streets. So it helps in terms of getting that perspective.
Also, I'm a facilitator at the Bible study, which we'll normally have on Monday evening at 5 p.m.
Places like Trinity, especially we thank them, are grateful for the soup kitchen, and also, they provide doctors, counseling, So it really helps a lot.
Trinity Clinic is a student-run organization where we help out the homeless people of Braamfontein.
I'm a fifth-year medical student and I volunteer here at Trinity Health Services. So patients or members of the public will come, particularly homeless people will come, get a cup of soup and some bread, and then we have healthcare promoters who go out and chat to those who are attending the soup kitchen, see who might need any medical attention. We're overseen by professional medical doctors as well as pharmacists. The doctors supervise all the medical aspects of the clinic, and there's a responsible pharmacist who supervises the pharmacy end of things.
I was recruited by students in that first period of the clinic when the clinic was running, having just been started. The students themselves initiated it in response to a need that they'd identified. And for me, the real learning for students in this space is social justice, is this notion that here's a group of marginalized people in a whole range of ways from the broader community, even more marginalized than the patients they would normally see in the hospital. So here they're making a decision to engage with these patients, these people who need care. And for me, that's a really important thing because it's driven by students, it's managed by students, and we're only the supporting cast. We are really the background people that provide the legitimacy to the space.
We get third and fourth years medical students at WITS who will first see the patients. So they just get the general complaint of why they're here and what help they need. From there, they're allowed to go downstairs and see the fifth and sixth years, who are the final year medical students. And then they do their diagnosis and the examinations on the patients. The patients can also then, from there, go and get their medication that they need because we have the pharmacists from WITS as well, who help out with the drug dispensing.
I'm a staff member at the Department of Pharmacy and Pharmacology at WITS, and I'm responsible for the pharmacy. Trinity Health Services is a student-run clinic and was established in the early 2000s. It closed for a bit and then it re-established in 2015 with a pharmacy that now is incorporated with the clinic.
We offer a basic primary healthcare service for the homeless people of the inner city. So it's any minor ailments, basic bandaging, and basically our aim is to just try and help those people who often get missed by the rest of the healthcare services.
Some of them are coming back on a regular basis for care, and then we have to work with them and make sure that they get referred to more tertiary levels of care because this is a primary healthcare facility. So if we're not able to adequately attend to whatever medical condition they have, then we need to refer them to either Charlotte Maclecker or Helen Joseph Hospital or Hillbrow, which is another one of our referral sites.
Then I got TB last year, then I go to the clinic. I didn't know what is happening to me. So they said, okay, they checked me for HIV. I said, no, it's fine. Then they checked me for TB. They caught me for TB.
HIV is a huge problem. So I and a medical student, Graham Lawman, we then set up a research project. We then launched the offer of testing to people who were coming to the homeless soup kitchen. And all of that data was then kind of crunched by Graham and myself. Anecdotally, poverty and HIV, there's strong connection. But we found that in actual fact, homelessness in itself wasn't a strong indicator for vulnerability to HIV infection. We found that it was, in actual fact, employment. Employment was protective. If you were employed, you were less likely to do those kinds of things which would expose you to HIV. So the study was published in the South African HIV Clinicians Journal, and it was called HIV Amongst the Urban Homeless.
This is a very fulfilling service that I personally think I provide to our homeless population. So it gives me courage and motivation because of the fact that I know that I am helping someone. My hope is to create a healthier and productive society.
I like the fact that we can come here and it's down to the basics and it's not exaggerated, and you can do so much by just offering up so little of your time, and it can make such a huge difference for so many different people. I mean, we see 20, 40 people per night, and this wouldn't have been possible if it weren't for people that were willing to come here and volunteer and give their own time to help those in need.
It's awesome to be a part of such a group student effort. It's nice to be a part of something where the students are the ones pushing this initiative and coming up with ideas and thinking of ways to better improve this for the people that we're serving. That also is another huge plus, is actually meeting the people that we serve. The stories that you hear, the lessons that you learn, I mean, you can't compare and you can't actually quantify it. It truly is incredible.
So for me, it's a great opportunity as a lecturer to be able to volunteer and to be able to work in a clinic such as Trinity Health Services with the students in serving a community. And the second thing is that I am Catholic. So for me to be able to act out my faith and to be able to help other people is an amazing opportunity.
What excited me about Trinity Clinic was being able to come through and help out the homeless people here at Braamfontein. We can come through, hear their stories, listen to what struggles they have, and try and help out however we can.
That's a highlight for me, being part of a community that is trying to provide holistic care to people who are most vulnerable.
Our hope is that the clinic continues. And that as the clinic continues to incorporate other disciplines. Services that the community really are in need of are dental services, psychology, social work. And as we expand the disciplines, we're actually teaching students to work as an interprofessional team.
I'd love to see every health science discipline getting involved. I mean, something like dentistry for this community is so crucial, and to have them becoming involved would be phenomenal. To have OTs, so occupational therapists, physios, nurses, psychologists. I think to see it become a true representation of like what a multidisciplinary team should be would be phenomenal, and even better to have it at student level to start initiating and forming those relationships going forward. I think that would lay a foundation that would be like no other for the future going forward.
That makes me excited as well, is to see, okay, where are we at now? How are we addressing our patients? But also, how are we making sure that in future we better address their needs and help them out of homelessness and back into being contributing, thriving members of our society. Our biggest cost is medicines for our patients. They don't pay a cent when they come here. We don't ask them for any form of identification.
Our biggest challenge is funding. Is to establish a service such as this, that we are not funded by the Department of Health, means that we've got to raise our own funds. The second biggest challenge, I guess, is getting people to volunteer, professional staff, pharmacists and doctors. And as we expand the services, we'll need more volunteers.
The clinic exists at the moment in a charitable space. And I think that if people could recognize the impact that students are having, that I would hope it translates into some kind of support to the clinic.